Hey, y'all. Trigger warning for this episode. We talk about drug overdose, loss of a parent, violence against women, amongst a bunch of other really difficult things to hear. And if you can't tune into this episode, no worries. We hope you can in with us next time.
Welcome to the Pit Crew. I'm Camille, your attending, and I have my residents with me.
I'm Mal.
I'm Robert.
Robert, would you like to present today's patient?
Our patient today presents with a case of introducing themselves to someone they've already met before.
Yeah, I do that a lot, though. I meet too many people and I ain't gonna remember.
Oh, I don't know the names of half the people I work with. And I'm like, I know we've met, but...
Oh yeah, I'll remember your face, but I'm not gonna remember your name. So welcome to 9 a.m., episode 3, which Robert has decided to pick the title for. Robert, what are we calling this episode?
Welcome to the Deli of Death.
Hell yeah, brother. Would you like pastrami with your measles?
We pick right back up where we left off with Whitaker still doing chest compressions.
I do want to clarify, it is not the third hour of chest compressions. I don't know why this is the first, because every time I have watched this episode with someone, they've gone, oh my God, when it says hour 3. And I'm like, of the shift. It said hour 1 and hour 2 on the previous episodes. You didn't notice? It is not hour 3 of chest compressions, okay? It's hour 3 of the shift.
We pick right back up with Whitaker doing CPR. I'm not CPR certified, but I did take a class way back yonder. Obviously, those aren't proper chest compressions. They should be deeper. He should be on an elevated surface like a stool so he can have more leverage.
Right, but this is a TV show and you can't give real chest compressions to an actor.
But also, like, I don't know, they could definitely put a dummy there so you can actually look like you're given actual chest compressions. It doesn't particularly matter for me.
I did ask someone involved in the show about chest compressions and how you teach the actors to do that. One, they want it to be as legitimate as possible, so that's why it's not a dummy. And number 2, what they did in boot camp is they focused a lot on redistributing of the force of the chest compression to somewhere else in your body and still trying to make it look legitimate.
Yeah.
So they actually did, if you watch behind the scenes footage, they did practice their chest compressions on real people, but they had to make sure they were like doing it in a way that they weren't actually exerting that much force on people. And also, yes, proper CPR, you will break ribs.
Yeah, which I understand that Whitaker is like going through it right now. He's desperately trying to revive this patient. So maybe the 4 years, he's a fourth year medical student, right?
Right.
Maybe the 4 years of med school, that thing where it's like, oh, if you're doing proper CPR, you'll probably break ribs, just kind of left his brain as he's trying to revive Mr. Milton.
Because my brain was like, why does he not know that? Like, I know that, and I don't work in medicine.
There are a couple of moments in the show, particularly with like Dr. Robbie, who will explain to other doctors who have been around for as long as he has, or roughly around the same time, where he'll explain to them very basic medical terminology. And it's like, that's not for the doctor, that's for the audience.
Yeah, that's for us.
But they do a very good job of not doing that very often. I will say.
The rib thing kind of makes it seem like this is Whitaker's first time ever doing CPR, which I find hard to believe as a doctor, but
well,
I don't know.
So here's the thing. So well, you have to keep in mind, he's not a doctor yet. This is a rotation for him. This is only his second rotation of the year. His first rotation, he said, was internal medicine. So he wouldn't have really, I don't think he would have been doing chest compressions in internal medicine. But I guess, like, to me, you have to suspend your disbelief a bit, because I'm like, why doesn't he know that? So Langdon, it almost looks to me, we just rewatched this episode together, and I was watching his face, and it almost looks like he wants to make some kind of a comment, and then he looks at Whitaker, and his face gets more serious, and he doesn't say anything. And so I think, again, that's a really good, very good observational skills of like, this is not the time, I can't make a joke, which is a difference between him and Santos, is he picks up on when he can make a joke and when it's not appropriate, and she doesn't. She doesn't have that finesse yet.
He makes some wisecrack as he leaves. He's like, call me if there's a resurrection, which is, hey, in the off chance this guy does survive and we resuscitate him, call me back. But also, he's saying in that joking way of like, it's probably not going to happen.
It's not going to happen. But he walks away and immediately asks Perla about dogs, pets.
Perla's mother's mentality and her mentality about pets is kind of funny to me. Don't keep a pet that you can bury at sea, because how are you going to explain to your plumber why you flushed a hamster down the toilet?
But she says her house is like a zoo, but she apparently only keeps animals that you can flush. So, like, she's got a zoo of fish. That's an aquarium.
Like, birds.
You're gonna flush a bird?
Please do not flush birds down the toilet.
I'm such an empath that this entire conversation is upsetting to me. Can't handle it. But it's a good, I like how this whole situation highlights how healthcare workers just kind of have to like be as superficial as they can, but also be as genuine as they possibly can. And it really exemplifies just how much Langdon is able to stay at the surface and be like, I mean, it's easier for him because he never treated Mr. Milton, but he has to take that step back and like, there's nothing I can do. I might as well just go on with my day kind of a thing.
Yeah, which is crazy to think that they have to do that.
Yeah.
Yeah, I can't do that.
No.
Now Javadi approaches and she wants to know all about McKay. And girl, you ain't slick.
It's really funny how she's like, hey, you know anything about like where she studied, what she does?
No. The words that
personal
she
life?
said, do you know what she did before this? She is very much fishing for what she did to get the ankle monitor.
She really casually drops a like, do you know anything do you know what her life was like before the year?
Hey,
And
Langdon, do you know her social security number and like what she snorted or her favorite food?
I love how Langdon does give it a genuine thought where he's like, she's a son. She's a son. That much I know. No, she's a really private person.
But is he right though? Is he right? Is she actually a private person? No, not that. Yeah, she has a son. No, is she actually a private person? Because I don't get that vibe from her.
She's private.
She's an open book.
She's private to Langdon, which I think speaks a lot about maybe the relations between McKay and Langdon. Do they interact in this show? Am I misremembering if they ever
A little
really
bit.
interact?
There is a little bit. Mostly, I want to say during the mass casualty.
Right.
They kind of have moments of like interacting, but especially when it's like when Jake comes in, I think.
They don't have any kind of banter or rapport. They don't really talk to each other in a professional manner of any kind. Yeah. They just work in the same place. So, hey, maybe it's just that Langdon, because you know what? McKay has her thing where as she reveals later in this episode, that she has been on the other side of a man who is dangerous, who hates women. So maybe that painted her image of like all men. And I think the only men she really interacts with in a positive manner is what, Dr. Robbie and Whitaker?
Well, and Mateo.
And Mateo. There we go.
So my big thing is like I had to explain to a coworker recently because he's very young and he is very curious and he asks a lot of questions, especially just about like life in general or for advice and things like that. And recently I saw a video that I was like, oh, this will help explain it to him. And it's a video explaining that like women are like, it's not necessarily wrong for women to be scared of all men, because like no, it's not all men, but it also is like the majority. And the comparison they made is they said the majority of like wasps that you will ever see in your life are not going to sting you, but you are still scared of wasps.
Yeah.
So like yes, you can be scared of all men even though statistically the majority of them are not going to hurt you. And I had to explain that to him because like as an abuse survivor, I get very nervous around men, even men that I trust and love. Sometimes I just get really, really anxious around them. And I don't know why. I just get scared. Something in my brain is like, wee woo, like alert, alert, alert. And that's not founded in anything except for the fact that I have trauma. And sometimes my brain just haywire, just goes haywire.
Yeah. I mean, that makes sense.
So, and that's us reading a lot into something that is founded in nothing but potential, very much a potential. So when Dana approaches Langdon after this, I love this. She does like that opposite shoulder tap and he looks the wrong direction before looking at her. And I love that. And there's so much of the little stuff in the show that you think is like, you're like, oh, that must have been like improv. And it's like, no, it's in the script. Like there's so much good stuff that is very practiced that is just so natural. These actors are so good at making everything look so natural. We talked about this previously. Mal, you pointed out that there's a discussion had about Nick Bradley.
Heartbreaking. The worst person I know just made a great point.
Yeah. Langdon points out that there's basically what he's saying is there's no hope for Nick Bradley and they need that bed. And he's not saying pull the plug, let's go. He's saying we need to move him up to ICU so that we can have that bed to actually try and save someone. And he's, again, not wrong.
Yeah.
Right.
I like how Dana is trying to defend Robbie a little bit and being like, maybe he sees something that we don't, and Langdon brings it back down to reality where it's maybe he's trying to see something that isn't there, something like that.
And it's 9:00 and she's already bumming him out. We see another similarity between Santos and Langdon. Langdon is cherry picking cases, but Dana calls him out for it, and he's like, okay, fine. Like, he's not actually, he's just, being annoying. I'll take projectile vomiting in North 5 for 200, Alex. Ah.
But guys, at this point, when the show was being recorded, Alex Trebek was dead. So why would they say Alex? Why isn't the new guy?
Because it's the reference.
I think
gives
that's
a fuck about the new guy. Because you said
I don't know
Alex,
the new guy.
And then you said the new guy.
Right.
I'll take projectile vomiting in North 5 for 200, the new guy.
New guy.
Like,
Yeah, no.
That's why.
Love how he's picking and choosing, just like Santos.
Yeah.
So alike.
But then, he also still does. Now, here's the thing. He's going through, and yes, he's cherry picking, but he also has valid, it's not like she's like, boring, boring, boring. I want this one. It might be spiders, which is not. But he's saying they need a UA first. By the way, if you don't know what a UA is, that's a urinalysis. It's a pee test. So you need a UA.
But then also there's the butt abscess that he's like, this would be a great teaching case. No, I think you just don't want to deal with the butt abscess.
Yeah.
That's my personal take on that, because I wouldn't.
Everyone respects a urinalysis, the person doing it, because they take a little sniff, little sip, they send it off to the labs. That part wasn't necessary, but hey.
Robert! Shut the fuck up.
Holy God.
Just sip a little piss. It's fine. It's good for you.
Little sniff, little sip.
Stop.
Treat it like a wine.
Bear Grylls says.
Treat it like a decanter.
Make sure you taste it on the back of your tongue. That's where the palate really,
So we come back to Collins and Manu, who has this interpreter. One of the things I like about this interpreter scene is that is it translator or interpreter? What's the difference? One I know is one's for text.
I believe a translator is translating languages. Interpreter would be someone like sign language. No?
Okay.
Yeah, someone who's doing it in the moment is an interpreter.
Okay, good. So yeah, because I was gonna ask, because I know one is more focused on translating text and one's more focused on translating speech for conversations.
Yeah,
that's something.
I would think it's because an interpreter is in the moment.
This is apparently a common enough thing for a lot of med students where they will sort of set up the translator next to the patient and sort of speak to the translator, when in reality, setting the translator up next to you and speaking to the patient and catching those fine tunes when it makes different gestures or features or whatever when you're speaking, that helps with the humanity of medicine.
Absolutely. It's I don't know if you guys have ever, my mother goes with me to see my cardiologist every year. He looks at me. I'm the patient, and she can ask questions and he will answer the questions, but he makes sure he's looking at me because I'm the patient, not my mom. And so it's a definite, when you need a translator or an interpreter or something like that, it definitely is a very good point to make sure that you are looking at the patient. The translator or interpreter is not your patient. They are not the one you should be focused on. I did Google the difference between an interpreter and translator. A translator works with written content. An interpreter is with verbal content. So.
All right. I was right. That there was one.
Good for you.
Good for me. Oh my God.
Oh, you get a point.
Oh my God. Hell yeah, I get a point.
You can exchange your points for one punch to the face.
I'll be sure to travel to your apartment right now so you can punch me. Anyway.
Thank you. Now the entire audience knows that I'm in an apartment. Great job.
An apartment that can be found at this address in Nashville, Tennessee.
Statistically, you're an apartment or a house or a secret third thing. You live in a circus.
So Manu can tell that Collins is pregnant. And it's actually so sweet.
Very sweet.
She's so genuine about it.
She's like, when are you due? You can always tell. And this does send Collins into a bit of a Congratulations. This does send Collins into a bit of a spiral of like, wait, shit, am I
Did this bitch
noticeable?
just call me fat?
And
I know,
she
and the way she, like,
readjusts.
checks out her reflection in the door on the way out.
Zips her jacket up.
Yeah.
Yeah.
Oh, Lord. So we go back to the Spencers, and Robbie's just annoyed because he's still not doing well. And Helen is just still not ready to let go.
It's very funny the difference in the way that Robbie is treating the Spencers versus the Bradleys.
Mm-hmm.
Like, because they both have sort of similar situation where it's
Right.
like the end result is kind of inevitable,
Right?
and he's just
He's like, bitch, you've
handling
had your time with your dad.
yeah, he's handling the Bradleys with much more grace, probably because like Nick is a lot younger and
Mhm.
this is far more tragic, you know, by
Mhm.
like traditional metrics. But
This just in, Mal thinks that the death of elderly people isn't tragic.
I think that they've lived life and an 18, 19-year-old kid has not.
No.
Okay, I'm just saying.
That is a question I will ask in a little bit for confirmation if it's a mess up or not. But what I was gonna say was that Gordon Ramsay meme that's like, Dr. Robbie with the Spencers, you fucking donkey. Dr. Robbie with the Bradleys. Oh,
Yeah.
sweet, sweet, sweet girl, sweet girl.
Exactly.
When we come to Robbie with Mr. Milton and Whitaker still doing chest compressions, Santos comes up and asks if she can do a pericardiocentesis, which is a procedure to remove fluid from the sac that surrounds the heart. And God, it just makes me mad.
Yeah, this is not the time, girly pop.
This is infuriating to me. She really wants to treat him like a cadaver, and she literally calls him that because she says, this is a teaching hospital. And Robbie says, not a cadaver lab. And she says, what do you call this then?
I mean, I kind of agree with it. Like, yeah, at a certain point, you kind of need to stop. It's not enabling Whitaker, but it is sort of something akin to it where it's like, buddy, he's
But
gone.
that's not what she's getting at. She
Oh,
doesn't
yeah,
care about
no.
Whitaker. She just wants to do something she's never done before.
She doesn't
And
care
she,
about Whitaker, but she does care that it's like, hey,
a learning opportunity, potentially.
yeah.
Yeah, she's like, this is done, this is over. Let me do something cool.
But I'm like, babe, like I will donate my body to science, but not you can't do that while someone's trying to resuscitate me. You can't use me for science then.
I will donate my body to science with a viable scientist. Santos, you're not a viable scientist.
Right. I'm like, baby, put me on the body farm. That's okay. After I'm dead.
Yeah.
Like,
Yeah.
Friends, we got another overdose.
we have another overdose. We have Jenna. We actually get to see Narcan used. And I did want to point out, yes, it really is that easy to use Narcan. Anybody can do it. It doesn't take training. You can get it for free in a lot of places. A lot of places have vending machines. They don't charge you. You just get the Narcan from it. Even if you don't struggle with drug problems, if you know of someone or you live in an area where you think you might run into it, or you go to a bunch of parties or you're in college or whatever, it's not a bad idea to grab some Narcan and have it with you. You could save a life. It really is that easy. There is no harm in using it if it's not the proper situation. If they're overdosing on something that Narcan can't help with, it's not going to hurt. But it will always help if it's the right situation.
People also need to reflect on what they think of overdosing as, because I think the majority of population will think overdose is like, oh, and like they'll use like terminology like a junkie and like a warehouse just, you know, sharing needles and doing really bad drugs.
Right.
An overdose can be your parent forgot they took their pills this morning and took them again. You know, an overdose can be a little kid getting into the medicine cabinet and thinking, "Oh, these look like candies. I'm gonna eat
Like
the whole
Sleeping
bottle."
Boy Tyler.
Yeah, there is any stigma that you have around overdose, and what your general idea is shouldn't be any reason why you should think that like Narcan shouldn't be readily available. That's always such a common argument against Narcan is like, well, then all the junkies are just gonna start getting high and they're gonna survive. And like that's kind of the
like,
fucking
be so
point
fucking
of Narcan.
for real.
Hey,
The
guess
point
what?
is
They're
that people
human people.
survive. Yeah. Yeah. And I
Yeah.
want to say there's definitely a discussion to be had around like safe injection spaces and things like that. I'm fully in support of those. However, there should be no discussion regarding Narcan. It should be readily available everywhere.
People are gonna do drugs, and
Yeah, this
you'd
like
be surprised.
superiority complex we have about like what sort of people deserve help does nothing but hurt people.
Right. Especially because you see these two overdose cases, they're not taking drugs to do drugs or party. They were taking what they thought was Xanax
To go to sleep.
to go to sleep because they were up late studying for a test. My God.
Are we supposed to like understand that they took like 2 halves of the same Xanax?
That's what I was about to
That's
say.
what I think. That's what
Yeah,
I think.
okay.
She took like half a Xanax, is what she says later.
Yeah.
And Nick is the one that bought the drugs. So I definitely think there is a good chance they could have split the same pill.
This also diverts into another conversation of if you are in a situation where like you went to a rave, you went to a party, you were just in your home by yourself and you did drugs of whatever variety, tell the truth to your care team.
Oh, yeah.
Please. Oh my God.
They're not going to report you to the cops. They're not going to, I mean, they might judge you a little bit, but like they'll also get over it but also they'll get the fuck over it to take care of you and make sure you don't
Right.
die.
Please tell them the truth.
Whatever embarrassment you feel about like, oh man, I got caught for doing drug, they don't care.
They don't care.
They see this a dozen times at least a day, and they just want to make sure you walk out of this hospital alive.
They would rather you be a stupid idiot who's alive than dead.
Right.
Yeah.
They would rather you be embarrassed and alive than dead. Okay? Please tell the truth. Even when
Yeah.
it comes to just the most basic embarrassing things, please tell the truth.
They will ask a million times, not because they're trying to judge you, but just they're trying to eliminate everything and figure out exactly what's wrong with you. I remember when I got my appendectomy, even though I had never done drugs to that point, regularly, and this is for a bit of a different scenario because they wanted to know, like, hey, if you take drugs, we need to know to adjust your anesthesia accordingly. And I would say, no, I don't do drugs. Are you sure, man? Yeah, you're around safe people. Hey, I smoke a joint every now and then. Like you're not going to get in trouble. We're not going to tell your parents. I'm like, I don't do anything, but I appreciate it.
Yeah. I don't know about you guys, but my care providers, part of the general, when the nurse comes in to ask questions about like date of your last menstrual cycle, things like that, one of the questions that they ask is, does anyone threaten you or make you feel unsafe at home or anywhere else? I appreciate that medicine has opened up so much to social things. And I think it's very important as someone with, which I mean, I'm going to bring it up a lot in this episode. As someone with heart problems, I see a few different doctors regularly, and I have seen the change in acceptance of social things and understanding how they play a role. The cardiology team at my hospital actually
you mean
has
the doctors have gone woke?
Oh God. The doctors have gone woke, and there is a social worker on staff with my cardiology team, and she is free of charge. She is just there to help because people with cardiac issues, they have seen not a causation but a correlation between heart patients and PTSD, CPTSD, anxiety, depression, things like that. And so they thought, you know what, part of care for this needs to be having someone to talk to. So they brought a social worker onto staff, and I have loved seeing medicine grow to accommodate that because it wasn't always like that. And they didn't always ask, are you safe at home? Is anyone threatening you, making you feel unsafe? They didn't always ask that. That's within the last 8 years, maybe, that they've started asking that. So Whitaker is really struggling after they let go for Mr. Milton.
And so is Mel.
Yeah, so is Mel. They're both really struggling with the death. And Mel is clearly very empathetic, very sensitive. She's doing something called stimming, which helps to regulate sensory input. It's also very common for ADHD people, for autistic people. She's actually doing something called hand posturing. What she's doing is called hand wrapping. She is like squeezing her hands. It's a coping strategy, and it helps with emotional regulation, which is not seen as harmful. As long as you're not hurting yourself, it's not seen as harmful. It's very much a good coping strategy. People use fidget spinners, things like that, or focus on, a lot of times in meditation, they'll say like, feel your feet, now feel your ankles, up to your legs, to your knees, kind of like feeling the different parts of your body. And so if you can focus that feeling in a certain place, it can help you to regulate. And that's great. She really brings her tools in. She knows how to help herself cope when she needs it.
We love coping strategies.
We love coping strategies.
Frank Langdon put the benzos down. Not those.
Not the bad coping strategy.
No, not those.
So, Captain America meme when Black Panther is like, get this man a shield. But instead it's get this Santos a chest tube.
Oh God. Santos really wants to do a chest tube.
And look, we love women asking for what they want.
Mm-hmm.
In this context, I don't know that it's it doesn't come off great. Especially because Collins is like, oh, you want me to just like save any chest tube for you? No, get real.
Yeah.
No, not everyone. Just, I'd be more than happy doing one.
Just one is fine. Yeah.
If you have more for me, I'll be more than happy to do it.
Yeah.
And then
Now,
she gets ripped apart a little bit where she's like,
Yeah.
hey, what's the exact wording? It's
something to be admired, basically.
Ambition is something to be admired, but it should be like being driven and ambitious is to be admired, but also should
Humility
be
and compassion.
Yeah.
paired with humility and compassion. So
Yeah. It's so, and here's the thing. I have no problems with her asking for this. Good for her. Ask for what you want. You're a student. You want to learn. You want to know. She wants to know what she wants to know. She's got a bunch she wants to do. I think it's just immediately following what she said about Mr. Milton that makes it sting.
Mm.
And Collins doesn't know this, but we as the viewers do. And I think it just makes me like, ugh, come on, man. So we immediately go into a debrief in which Whittaker, unfortunately, has 20/20 hindsight. He's thinking of all these miracle things he could have thought of, and it's like, baby, it wasn't right, though. If you should have, you would have. And all these other very experienced doctors would have.
You did all the right things. It
You
was
did the
just
right
like
things.
a freak event that no one could have predicted.
Right.
No. 150,000 people die every day in the world, and he was just unlucky enough to get one of them.
Yeah. And then they'll get many, 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 many more. But this moment is meant to be validating for Whittaker, I think, because none of the people in there are blaming him. He did everything right. And yeah, again, sometimes people just die.
Very true.
And that's clearly very heavy with Whittaker because he mentions it multiple times.
It is kind of interesting that we never meet his wife.
Yeah, I think we just have too much going on.
Yeah.
And then this moment of silence has a lot of moments for us where, compared to the first moment of silence, Langdon is not moving around, so he's clearly settled down. Santos is clearly like, I want to get back out there.
She's making faces. She's looking around. She's bouncing on her toes. She's rolling her eyes. She's doing everything that Langdon did.
So similar.
Yeah.
But one of their behaviors comes from drugs, and one of their behaviors comes from
being a bitch.
I was gonna say being a cunt.
Oh,
my wife is a bitch, and I love her so much.
So Whittaker is giving this talking about Mr. Milton, and then Mel, God, the accidental clap. This is right before the moment of silence, and then just the she literally immediately is like, oh, and like puts her hands like holds. Oh God, little baby girl milking. This is the baby girlification. This is appropriate baby girlification. Yes, she is still an incredibly trained physician. She's smarter than me. Sassy, moody, nasty.
This is like my second favorite Mel moment of the episode. My first favorite comes a little bit later.
As they exit, Collins and Langdon shove each other. It's actually Collins shoves Langdon and Langdon shoves her back as they're exiting. And I just think it's really cute. So Robbie tries to check in with Whittaker, which is very sweet, but it ends up being so awkward because he's like, I'm going to pat him on the shoulder, except my hands just kind of hover here, and I'm going to finger guns. It's almost like just like a, you got this, kid. He's trying, but for some reason, he just fails so badly. Yeah. The pat on the shoulder, they almost walk into each other as they're walking away.
Listen, he can't be perfect all the time.
It's kind of giving, how do you do, fellow kids?
Yeah. Finger guns. So Santos comes in with the therapy talk with Javadi, and I'm not saying that this is disingenuous. Like I actually think that she is being genuine and trying to use what she's been told in therapy, except it just makes her feel so awkward and uncomfortable that she can't help but just default into like making a joke of it and being a bitch about it.
Because clearly this is a person who has had therapy, but like is still working on herself, because
she's using therapy seat
you don't
constantly.
Reach a destination in therapy. Like she is not fixed.
Right. She's hearing what the therapist is saying, but she's rolling her eyes the entire time.
Yes, like she knows what's up, but that doesn't mean that she's not going to start feeling weird and then immediately revert back to these like self-defense methods that
She's
she uses.
absorbing it, but she's not taking it to heart, I think is the way to say it. Like, is that the best way to, like, it's not that it's bouncing off of her. Like, she's getting it,
Yeah.
but she's just not getting it. She's not allowing it to really land. Emotionally, she is refusing to open up.
It almost feels like, not that she's not getting it, because I think her echoing, like, shows that it
She
has sunk
understands
in.
the value of it for other people.
But I think she hasn't, like, actually done the work yet to fix it, to not resort to this, like, self-defense through jokes and things whenever she starts feeling uncomfortable. So, like, she can't even really have a real conversation because she immediately has to, like, get into the sarcasm.
Right.
Even when
Right.
she's, like, explaining that she uses sarcasm as a defense, you know?
And so I genuinely think she is kind of trying to apologize, but then maybe she has this
But she's
moment of
not very
like,
good
too
at it.
tender, yeah.
Yeah.
And then she just fucks it up all over again.
Yeah.
I love to point out this moment is that if I was watching this episode with my mom, when I watched it for the second time ever, I was watching it with my mom, and as they're walking through the hall, I literally said out loud, huh, Langdon is watching. And at that point, the whole season wasn't out yet. So I was sitting there and I was like, huh, is this going to come back? And it does. It does. It comes back in, I want to say episode 9. He will mention this conversation to Robbie late in the season. But Langdon clocks this entire conversation. He hears it, he sees it, he is in the background of this scene. And I just love that. Love that. So Santa says that she's sorry. She didn't really mean to hurt her feelings. And then she continues to do the thing that hurt her feelings. And she calls her Crash and she says, I can call you that now that we're friends, right? And I'm like, stop being such a mean girl. It's like Regina George.
Stop trying to make fetch happen. Fetch will never happen.
It's never gonna happen. It's very much like, oh my God, I love your necklace, you know?
Yeah.
Like, it just like, stop. I do want to stop here and we're going to talk about Santos because Issa Briones has done an interview and she talked about how Santos was a competitive gymnast. So that is her backstory. She was an athlete. The creators told her, they were like, listen, you can choose a different sport. You can do whatever you want. She was like, I think that being a gymnast fits this. The canon that there is for Issa, or that Issa has shared for Santos, is that she was sexually abused by a coach. Very much a Larry Nassar situation.
Mhm.
And so she really is doing a great job of presenting this like defensive, damaged, mean, lesbian athlete. Like she does a great job.
Mean lesbian athlete, you just described my type, like, exactly. So it makes so much sense to me why I will forever and always be a Santos defender, because I'm like,
Yeah.
yep.
Yeah.
Yeah.
So I'm gonna read this quote from Issa from an interview. It says, especially when often in gymnastics you're going into it so young, so it's drilled into you. We talked about a lot of her trauma kind of stemming from that part of her life, and a big part of why she pivoted so hard to, quote, now I'm going to focus on medicine. I'm going to focus on something else that I can try to be the best at, end quote. You definitely see it in how she interacts with her colleagues because she's like, I'm not here to make friends. Because clearly she's been in environments before where that is not the goal. It's to be the best. And that is so incredibly obvious. Like, brava to Issa, because she does a great job of portraying that.
Oh, yeah.
And I will never, ever in my life ever say that Santos is not complex and very complicated. It's just that she triggers like this defensive part of me as someone who was bullied relentlessly in school.
And also, like, this is her first day here. I have faith that she will calm down, I guess,
Yeah, I was gonna say chill the fuck out.
Yeah, lack of a better way of putting that. Like, I think eventually she will realize that it's not a competition, and you get to be a good doctor by relying on the people around you and, like, learning from them as much as, like, from your own skills. And so I think, she'll figure it out. And I think the people she's working with will kind of figure her out, and they'll kind of all get used to each other and will, build some relationships. But, like, because the thing that's, like, kind of hard when watching a show like this is to remember that, like, this is all one shift. Like, this is the first day that they know each other. So, like, they have a lot of growing to do, and they're not going to have, like, a complete character arc in this one day.
we have Hank who comes in with a nail
Good
in
old
his
Hank.
chest from the ensuing melee. Collins tells Hank to dial down the F-bombs, and I'm like, girl, this isn't a church. Shut the fuck up. If I have a nail in my chest, I'm fucking swearing up a storm. Shut the fuck up. Don't tell me not to swear. You sit here with a nail in your chest and then don't swear about it.
Yeah, ow.
No. It makes me so mad. Then he says something about, like, is this a vet clinic or a hospital? And he's asking for pain meds. And she says, very soon, Hank. And he
Oh,
says,
I
I
bet
bet you
that's what
say
you
that
tell all the beagles.
all the beagles. And then as we cut to the next lines in the background, you can hear him go, it's,
And then they finally knock him out, which is amazing.
it's
Thank
so
you.
good.
But not before he's like telling them he's going to destroy them on Yelp and nobody is ever going to come to this hospital again. And the way that Ravi goes from your mouth to God's ears, hilarious.
Also, what has Hank been there for before that made him hate the hospital? Because he literally, as he's limping in with Mateo, he says, I hate this fucking hospital. And I'm like, what?
Well,
What is
I mean,
the
he
backstory?
was shot with a nail gun. Like this feels like a guy who has been in situations like this before. Like very clearly
is
he
he
doesn't have very
working with?
responsible friends.
No.
The part that's like, I'm gonna ruin you all on Yelp. My boyfriend who works in a hospital turned to me and he's like, oh, it's so funny to read the Yelp reviews or Google reviews of the hospital you work in. We do that like when we have like a little break or whatever. And I'm like, oh, that's that's funny. And then we've read some of like the reviews for his hospital, and they're very funny because people do treat hospitals like a Taco Bell.
No, I actually did just get a Press Ganey email in the past week. So I need to go fill that out. Going to be 5 stars all around. It was wonderful. I will say about my physician assistant, she is always on time.
Love.
She is on it. If she is not on time, she is early. She is incredible. And she does go fast, but she like takes the time she needs to take with you and makes you feel very heard. And I adore her. So in this trauma scene, we do have 2 med techs. You can look in the background. You will see Millette Cabot. She is a physician assistant. And you will also see Ambar Martinez. She is a nurse. And they are the 2 med techs in the background of the scene playing nurses.
Icons.
Yay!
Icons. And then Mel reintroduces herself to Kiara, and she's like, yes, we've met. And listen, Kiara, take the handshake. It won't kill you.
No.
You can say we've met,
She
but
doesn't
also
have one of
shake
those
hands.
zappy buzzers in her hand. Like, just shake her hand and say, hi, nice to meet you, please.
Listen, it has been a crazy day already. Like, this is her first day. Like, you can extend her some grace.
If I were Mel in that situation, I would kill myself.
Yeah.
Disclaimer, I'm not being serious. That's just my humor. I'm very sorry.
I would simply pass away in the moment. I would just like cease to exist.
I ascended into heaven. Goodbye. So Mel is struggling with this idea of Sleeping Boy Tyler in a similar way to Whitaker struggling with Mr. Milton. We are all, like physician heal thyself, we are all really struggling with something somewhere. We will get into other people and them struggling as well later in this episode. But I do want to say, I will tattoo "Stemmy with me, Mel" on my forehead. I don't know why I love that line so much. When Langdon runs up and says, "Stemmy with me, Mel," I love that. And I don't know why.
Okay.
It's just so casual. It's just like, yes, bestie, here we go.
It is cute and casual, but tattoo it on your forehead?
Yeah.
All right.
Yeah. So Langdon grabs gloves for himself and for Mel, and she gets like this like bright, happy look on her face, and it's so cute.
I do love as they are approaching the doors, Langdon slaps on the top and Mel is too short, so she can't quite get it. And that's my favorite Mel moment of the episode.
Yeah.
So cute. It's so good.
It's like she's so excited to have a friend that she like wants to do what he's doing. It's so cute.
It's so cute. Oh, she's like, this is the vibe. I got it. Nope, I don't got it. But as they're walking past the active trauma scene right before that, or as they're walking to the doors right before that, we see this active trauma scene going on, and it is like chronologically perfectly timed. And I like it anchors you in where you are in time and space and just reminds you of just how much is going on at once. And I love that. I think that is an incredible creative choice. So Santos says about Hank, this is so fucking cool. And Collins calls her out for swearing. And then she says they say swearing is a sign of intelligence. I think it's a lack of self-control, but what the fuck do I know? Am I stupid? Because I don't understand.
Like, you don't understand what she's saying?
Yeah.
Well,
Why did she swear? Like, I'm confused. Is she saying she has a lack of self-control too? Am I stupid?
I think she's just sort of teasing at Santos, being like, people say A, I say B, but what the fuck do I know? You gotta like do your own thing and prove which one you are.
like, we're all swearing.
We're all
Yeah, but she's
swearing.
literally just told Hank to stop swearing. And she's giving Santos a hard time for swearing. And now she's saying, but what the fuck do I know? And I'm like, I'm so confused. Listeners, if you understand it and we're all sitting here looking like fools, please email us at pitcrewpodcast@gmail.com and please explain that, because
I don't know. I think she's kind of joking around a little. Like,
a little bit, part of me is like, what's the meaning?
I think she's also kind of calling out Santos, kind of like Robert said, because it's kind of if it's a sign of intelligence, maybe you're really intelligent, but if it's a sign of a lack of self-control, maybe you lack self-control. So like,
So what the fuck is Collins saying about herself? I don't know.
That she's one or the other either, and you can pick which one.
I like that Dana always has gum or mint. Like, classic smoker. She's always either chewing gum or she has a mint. Mr. Gellin comes in for his STEMI. By the way, a STEMI is a heart attack. It's not the procedure. I thought a STEMI was a procedure. A STEMI is a heart attack. It's a type of heart attack, which is like a full blockage. And so, like, I didn't know that. Like, a code STEMI or a STEMI procedure is what you would do to help with a STEMI. But a STEMI itself is a heart attack.
Interesting.
I know. So I have a fun story about when Dr. Robbie says something about how they're going to use clippers and do a cath to, open up a stent and, open his heart back up.
Oh, but I love how he says, don't give me a full Brazilian.
So that's where the story comes in. Okay. In 2016, I had a valve replacement through a catheter. And before, like the week before, I went to have a wax, because I was like, you know what? Like, I have like a wax package left. And so like, I'm going to go, it's not like a full Brazilian, but I'm going to have them like clean it up, because I know they're going to use trimmers or like clippers, and I don't want them to have to do all that. So I'll just go ahead and have it taken care of. And so then I go in for the procedure, and it had to be like 8 hours after I woke up or something. I finally got up out of bed and I went to the bathroom, and like, TMI, but we're talking about a medical show. Before you can leave the hospital, like, you have to pee. They won't let you leave if you don't pee a certain amount. And so like, I was desperately trying to pee, and I went to the bathroom and I sat on the toilet and I looked down, and they had used the clippers and like ruined my wax. And I had like I was coming off of the anesthesia, and I just started sobbing on the toilet over my wax.
Oh no.
I could not emotionally. I just was done. Like, I was in so much pain. I was so tired. I did not feel good. I sobbed over my wax. So
they might have fixed your heart, but they ruined your wax.
They ruined my pubes. If you haven't cried over your pubes at some time in your life, I encourage it. It's cathartic. So
sure.
Mel is really excited about having saved 2 patients, and everybody else is just like, except for Santos is like, I just held a beating human heart in my hand. And I'm like, no, you didn't.
It's very cute that they high five, though. Like, I enjoy that.
It's cute until you realize that Santos literally pulls her hand back and then like shakes her fingers like, ew.
Oh,
you held my hand too long. Yeah. I think that everybody should take a page out of Mel's book. It's really exciting to save 2 lives. And they all should take a page out of her book, Yeah. So Joyce St. Clair is going over her medical history with Mohan, who is missing out on all of these traumas going on because she's spending so much time with her patients that are stable. And Joyce's wife, right as Robbie is about to interrupt, Joyce's wife says she has her entire medical history on her phone. It's extremely long, and hands her phone to Mohan as Robbie is walking in. And I'm like, oh, the timing. So like, okay, on the topic of good nicknames, Slow-Mo.
Oh, it's a good nickname.
It's a good nickname.
It's unfortunately true.
Yeah. Did you know that in the script for episode 1, Langdon is the first one to call her that? And it's when Jack is still there, Jack Abbott, and Abbott says that she is the smartest one of all of them.
You want to talk about shipping?
Oh my god!
I just said, like, I don't think there should be any romance on this show, but
No, that's it.
those
Oh,
those
yeah.
two. Something about it.
It's so good. It's so good.
But also, you want to talk age gaps? Because
That's one I can get behind.
Woo.
Robert, it does not look amused.
What? Jack and
Mohan.
Mohan?
Mhm.
Sure, why not? Listen, Jack Abbott. That's all I have to say.
Yeah.
Yeah, I was like, Robert just wants a piece of Abbott and is
You don't
supportive
have to
of
say
anyone
Jack.
wanting to
We
get in
get
there.
it.
Ha. I do hate how Robbie is like, he's like, I'm not doing this to rib on you. However, you're wasting time and money on unnecessary tests. You keep patients waiting for too long. And it's like, shut the fuck up. What about the Bradleys? What about the Spencers? You do the same thing.
Yeah,
Yeah.
the unnecessary tests bit, I was like, okay, pot, kettle, because he's been doing nothing but unnecessary tests
Yeah.
on
Nick Bradley. Yeah. But he does also say that she shortchanges her education by missing out on cases, and he's not wrong.
Yeah.
She is too scared to get in on the high-risk cases because she doesn't want to lose a patient. And I want to hear more about that. Hopefully in season 2, I want to know why
Yeah.
she's so scared of losing someone, because it is clear that she has made a
Something has happened
mistake.
there. Yeah,
Something
yeah,
has
yeah.
happened. The same as with Santos, as we'll learn in a little bit. So Myrna asks Dana for some tea. And if you watch later when Santos and Mel are talking, if you look in the background, you will see Dana giving Myrna a cup of tea.
I love that.
Yeah. So
I'm just glad that Chekhov's tea paid off and she got her cup of tea.
yeah.
Almost 100%, it's like Lipton tea.
Yeah.
So, John, Lily, we understand he's your only son. But also at some point,
Yeah.
Robbie needs to maybe put his foot down a little more and be like, I'm so sorry, there's nothing we can do. He's dead.
He's dead.
He gives them this last test, this, what the fuck, is it cerebral something?
Cerebral perfusion study.
Yeah, and that is, at least he sets the boundary of, this is the very last test we can perform. Because if this test comes back with the result I'm expecting, 100% without any shadow of a doubt.
But then the honor walk is 5 hours after this.
Well, and it's like, it's interesting how, not to bring up something that happens much later, but with the drowning victim later, it's very interesting how quick he is to call it and tell those parents, like, it's over, versus, like, what happens with...
Well, I think it's because
Nick.
she doesn't have a heartbeat.
But there's also the thing of, like, you know, later on is like, that the little girl, they take her potassium, I guess, from
Her
like
potassium. No one has survived a heart attack with a potassium over 12?
Of 11, and I think she had
11.
14.
So
she
there
was
are
super-
like, yeah. And it's just devastating.
There is hints of hope that maybe, just maybe, this could be that 1% that Nick will survive and wake up and blah, 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 blah. There was no chance at all with the drowning girl.
It's an age thing almost as well, because later Robbie has a really hard time letting go of Jake's girlfriend.
I think it's the ones in the same age range as Jake.
Yeah. Yeah.
I mean, I think the same way that Langdon has, you know, a lot of feelings about sleeping boy Tyler, because he's got a son who's 4 years old.
Mm-hmm.
I think.
And when the girl like drowns and they confirm that she's dead, he does call his wife to be like, hey, can you put our son on the phone? I just want to hear his voice.
There is also something just so intimate and heartbreaking to me about the fact that Lily is holding on to Nick's foot. She's standing at the end of his bed, holding on to his foot with both hands. That is such a mom thing to do. There are very few people in the world who will hold your foot. Your mom is one of those people. At least my mom is. I don't know. She'll hold your feet for you if you want.
Hey, so Myrna's valid because she's like, I killed my husband by putting him through a meat grinder.
Go off, queen.
Yeah, I do love how it's one of those things where like she just tells whatever story she wants because Robbie is like, oh, how'd you do it this time?
I put him through a meat grinder.
This is clearly not the first time that Myrna has been like, I killed my husband.
Very quickly, because Mohan has already heard that Whitaker has lost a patient, and she's trying to be very encouraging, even though she clearly does not cope well with losing a patient. Physician, heal thyself. She is hesitant, and then later on, she's like, we're gonna work this lady up like a race car. You're part of the pit crew. And I'm like, girl, Yeah, come on. You're part of the pit crew. Oh,
Yeah.
yeah, that's me. That's us. Ugh, go off. But, like, physician, heal thyself
There's a patient who just needs some Mylanta and to
for
also
his
stop
GERD, which is
for his
like
GERD
heartburn. Yeah.
and to stop eating foods with the words red hot in it for several
Flaming
days.
hot.
And listen, red 40, they'll kill you. No, no, they won't. That red 40s are fine. That study that's like red 40 might be the cause of ADHD in children is also bullshit. Anyway, they go into the lounge together, Mohan and Whitaker. She's talking to him about like, okay, like, hey, make sure to give it a shake before you go. Oh, wait, make sure it's closed tight before you shake. Oh, he got it all over his body.
The first of many liquids that will be on Whitaker today.
From what I've
Oh,
seen and what
Lord.
I've learned and researched and asked, it is not it's a terrible shitty day, but it's not uncommon that at least like it's happened once in your career where you've just been changing your scrubs like every hour on the hour because somebody pissed on you, somebody got blood on you, somebody spilled the medicine on you.
I went to make an iced matcha once at Starbucks and the lid wasn't all the way on. And when I went to shake it, it just went all over me. So that was awesome. It was great. I hated it. So Mel comments on how everybody seems to get along super well. It's like a family. And she's watching Collins and Langdon walk together as she says this. And she's really enjoying the vibe, but Santos really doesn't give a shit. She's like, yeah, I don't think so. And Santos joins in on the hot gossip, which is Javadi and her mom being a surgeon, which, I mean, Mel is really excited about. She can't imagine what it would be like to work with your mom. That must be so cool to have her so close.
You can't imagine that because her mom's dead.
Her mom is dead. Rip. And then also Santos said, she goes, sorry. Unfortunately, my mother's going to live forever.
It's funny. I can't
It is
fault her
funny.
for that one. It is funny.
And like props to Santos, I do think she's trying.
That's one of the root of Santos's problems, mommy issues.
Right.
Mm.
Oh, for
Mhm.
sure.
But like poor Mel is just trying to make friends.
I know.
She just wants to make friends, man. And again, Robbie has incredibly little patience for Mr. Spencer's daughter. And my mom asked me if I had sympathy for Helen, and my answer was like, yeah.
Yeah.
I mean, yeah, I do. I don't think you could have as much time in the world with your parent, but I think that when it comes to that point, you're going to be like, not now. They can't go
Yeah.
now.
Yeah.
No.
He was fine yesterday. What do you mean now? He's going to die today? And so, like, part of me is like, Robbie, stop being so lax with the Bradleys and offer a little bit more compassion to this woman who is clearly really struggling just the same as these parents are. I wish Robbie were a little nicer to her.
Yeah, no, I agree. I think she's dealing with a very hard thing, and I know he's frustrated that they are making the wrong choice. My mom's mom.
Your grandma, which is what normal people would say.
Okay, but I'm talking about it from like the lens of the Spencer kids. But my mom's mom, when she was dying, turned to my mom's sister, my aunt, and was like, "Why does Jill hate me?" Jill is my mom. And my mom was like in the room. And so she was like, so then I had to like talk to her and be like, because my mom and her mom have like a very weird relationship. I think kind of similar to Helen. Like she felt like her parents gave more attention to her sister, and her parents gave more attention to her older siblings, and like didn't have a lot of time for her. And so she just like has had a lot of feelings about her parents for her whole life. And so she like had to have this moment with her mom where she was like comforting her as she was dying about like, I don't hate you, I love you very much, but like, and she was like, in the moment, you know, you can't get into like all the ways that she hurt me and like all the mistakes that she made because it's not the
It's
time
not the
for that.
time. Yeah.
Yeah. And she's like, so I just had to be like, I don't hate you, and I hope like, you know, when you get to heaven or wherever, like I hope that it becomes clear to you.
Nick's father, John, is talking to Dana and asking if his son is dead. And again, Dana can't say anything legally. She says, I'm not a doctor, but I do believe in God and I'm praying for your boy, which is an incredibly kind thing to say.
It is giving a little bit thoughts and prayers. But
I
also,
think
like,
that
there's not
it's
anything else to say in the moment.
yeah. I think how what's the best way to say this? There's something of the delivery of the line, which it's an incredibly kind thing to say, but the delivery of it, maybe it's where they're standing because 'cause they're in the middle of everything, so it can't be too intimate for
Hmm.
her to be like, "I am praying for your son." Because, like, as a religious person, there are boundaries where you shouldn't be like, "I'll pray for you," like, "Oh my god, you're gay? I'll pray for you." No. But I genuinely think that most of the time when religious people are asking if they can pray for you or saying that they're going to pray for you, we mean very well.
Hmm.
I think I have learned in a lot of scenarios, it's best to say, "Is it okay if I pray for you?" But I'm like, it's not, you're not going to stop me from praying for you. I'm not going to pray out loud in your presence if you don't want me to, but you're not going to stop me from praying for you. It's my religion. I'm going to
Right.
pray for you. Right, like, I'm going to pray for you, I'm falling asleep, and I'm gonna be hoping that your day is better tomorrow or, whatever, or that you have the tools and the people that you need to get through whatever you're going through, and so I think that it's a very well-intentioned thing. I just think it's very curious that Dana is more administrative, it seems like, which is not the role of a charge nurse, but we don't really see her doing patient care, which is weird to me, because the person who does administrative stuff is a nurse manager, not the charge nurse. So, like, why don't we see Dana doing patient care?
Maybe it's one of those things that they got medically inaccurate, question mark?
I doubt it. There are too many medical people on the show. I don't think they'd miss something like that. I guess it must just be like because she has to be there to help Robbie run everything, and so it would be too chaotic for the viewer, maybe. I don't know.
Hmm.
But I thought it was interesting that she's really not involved in patient care, like, at all.
Hey, question for something we missed a little bit ago is that Dana said Nick is 18, but for some reason we're saying 19. How old is Nick?
I think he's 19.
So is Dana saying he's 18 a script error?
Hold on, I have a screenshot of something.
Yeah, because I thought it was said that 19, but then she said 18. So
According to the patient board, he is 19 years old. Yeah, Bradley.
So nobody knows how old this child is. Got it.
No, he's 19. It's just that I think she could have just misspoken. Like, I mean, you've got a million patients. So Nick's father, John, after this conversation with Dana, he recognizes one of Nick's friends. And, like, it hurt me to realize that these friends are there to see Jenna.
hmm.
Like, they're not there for Nick. Now, granted, it's not like Nick is texting them like, "Hey guys, I'm in the hospital."
Yeah, and I don't know. I also don't think that Nick's parents would
Right.
be, because
No.
the thing that I gathered was that the friend that came in with Jenna, because she
Was
walked by when
surprised.
Mel and Santos were having that conversation, and she's like, "No, like she was dead, like she was
Like,
dead."
dead,
So like
dead.
she has been talking to people about what happened,
Yes.
and so it like makes sense that the friends would be there.
Yeah, and the friends did he genuinely seems surprised to see Mr. Bradley there, and then, of course, Mr. Bradley follows and they're all kind of in good spirits, and it pisses him off, and he accuses her of drugging his son. He's very upset.
And she reveals that Nick's the one who gave her the drugs.
Right. Nick is the one that gave her the drugs.
Yeah.
But then we will find out even more later, is that he was doing it to be nice. It's so emotional and so heavy. He's having such a hard time trying to cope with this.
And I mean, if they really truly did take two halves of the same Xanax, then him yelling about how it's not fair that she survived and his son didn't, like, that's incredibly true. Like, she got very, very lucky, and Nick was very, very unlucky. And, oh,
I feel really bad for this girl because, like, now she's gonna have survivor's guilt.
yeah.
But, I mean, she was sleeping presumably in her dorm with her friends, and they noticed that she wasn't waking up, but Nick was in his own room at home, and his parents didn't pick up on it
Hmm.
for longer than I don't know. But
But I mean, if you're living in a dorm and you basically share a room with two beds with someone, I think it's a lot easier for someone to notice that you're not okay. Whereas, like, if I, like, when I went upstairs for the night, like at my parents' house, no one came and checked on me when I was.
and, like, teenage boys are zonked out, man. He's a teenage boy. He's asleep. Well, a teenage man. We also just, like, the struggle with the Bradleys is really difficult because I think, like, I can't help but think about the fact that we could solve so many of these crises by having the drugs that people need being more accessible to them so that they don't have to get them off the street. Now, I'm not saying that he needed to take a Xanax. He didn't. But he also should not have been taking Adderall,
Yeah.
right? Because he was taking someone's Adderall or something like that. They had taken a bunch of Adderall to stay up and study for a test, and then they needed Xanax to go to sleep. So, like, one, don't take Adderall that's not prescribed to you and outside of the dosage and instructions. And also, like, again, like I said last week, is like, bro, ZQuil, like, I don't know. And like,
And also, if you've already taken something, maybe don't take something else.
yeah.
Like,
Or maybe, like, I don't know, part of me is like, ask your mom. Like, would my mom judge me? Yeah, but like, she'd tell me the truth. Like, she'd help me Google it if I needed to. She's my mom. It's her job, you know? And so,
the amount of times that I've Googled like something kind of stupid, like, can I take Zyrtec at the same time I take Advil or will I die?
yeah. Yeah. Can I, like, I take Zoloft every day and I have to Google, like, can I take Mullen root at the same time that I take Zoloft?
I ask my boyfriend who works in a hospital. We should start a counter every time I mention him, where I'm just like, "Hey, baby, I'm feeling sick. What should I take?" He's like, "XYZ," and then I don't take it because I'm like, "I'll just raw dog it. It's fine."
I
Raw dog symptoms.
okay, so like Veep is one of my other favorite shows ever, ever, ever. And it just goes to show you how much you really, 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 even if it's just like a natural supplement, you really should look it up first if you're taking prescription medications. There's an episode where they give her St. John's wort for pain, and she's on antidepressants. And so she's like high as a kite. And it's so funny. And they're like, but there's a moment where one of the characters is like, you gave her something that's interacting with her medicine or with her antidepressants, and now she's off her rocker. And he goes, it's herbal, it's from the earth. And he's like, yeah, so are mushrooms. And he goes, okay, that's illegal drugs. And I'll never forget. It's so good. If you haven't
That's
watched Veep, please do. What a brilliant show. Another banger of an HBO show. But again, like I think about how like if people were able to be open and honest about what they need, we could avoid so much trouble. Langdon.
Mhm.
If Langdon had been able to, if he had felt safe coming to someone and saying, I'm having trouble getting off these painkillers and I need to treat the withdrawals that I'm having, he wouldn't be where he is now.
Ask for help if you need it.
Please ask for help if you need it. And like, I get that a job feels like the whole world, especially when you're something highly trained like a doctor, but like, your life is more important. Your well being is more important than your job, I promise.
Well, because we know how Langdon got on the painkillers.
He injured his back helping his parents move.
See, so that's like a legitimate reason to be on painkiller. Like it.
He was prescribed painkillers by a doctor at the hospital. And then the reason that he started taking Librium was to help with the withdrawal from the painkillers. I can't wait to have that discussion.
Great.
As someone with back pain, that's going to hit really, really, really close to home for me. So I can't wait to have that discussion.
Huge.
Because I'm like, he's just a baby girl. It's like, God, he's not, but oh my God. Anyway, we did miss, there's a moment where where Santos says to Whitaker that he can take comfort in knowing that it wasn't something that he did that killed Mr. Milton. And she said, it wasn't your fault. Not all of us can take comfort in saying that. I'm like, girl, did you kill someone?
Girl, what did you do?
What did you do? And also, like, she hasn't learned enough from it because she continues to do things.
Santos just wants to kill people. Let a girl kill people.
You know what the difference is between surgeons and serial killers?
What?
Serial killers don't bill their victims. I stole Langdon's joke. Sorry. So yeah, now Robbie's pee struggles begin. He is desperately trying to go to the bathroom and keeps getting
Go
pulled
piss,
away.
girl.
Go piss, girl.
Robbie is okay with calling Mr. Krakosia the Kraken, but he's not okay with David being called an incel.
Yeah, the way he defends David all the time it's very interesting.
Yeah.
He's like, I don't want to ruin this kid's life. And like, yeah, there's a place for that. But also, you gotta remember that the kid did make a list of girls he wanted to eliminate. So, like,
I'm like, okay, if he said brutally murder, would you be taking it more seriously? Like, why is eliminate not so serious to you?
Like, when he ran, the cops should have been involved because, like, at this point, you have someone who has made a list of girls he wants to hurt, who is now on the run.
Mhm.
Like, I would assume, oh, he's going off to do something. Like,
Mm.
this is not we don't want to ruin this boy's life. Like, yes, but we also don't want girls to be murdered.
We have McKay explaining to Robbie that she has personally been on the wrong side of someone who hates women, which is so I don't think McKay gets enough credit or enough discourse. I need to be better about giving her more space in the discourse because she is so interesting and so relatable, and that like she represents the struggle that so many women face every day. Weird question. Mal, have you ever been stalked?
Not to my knowledge.
I have. And I'm like, I'm only 30. And when it happened, I think I was like 24. It's too common.
Yeah.
Fuck.
It was a boy who like thought that it was going to be cool that like it would show he cared that he knew my home address and where I worked and everything about me. And it was like,
Yikes.
oh my God, it's not flattering, dude. Like,
it's creepy.
we have got to do better. Robbie brings this up later. We've got to do better with like teaching young boys how to feel emotions. McKay is this great example of just this struggle that like women have to go through.
Yeah.
Which I almost want to be like, I want to encourage every man listening to this, if there are any. I think 90% of our listeners are female, but if there are any dudes listening, ask the women in your life if they have ever felt threatened or unsafe or have been stalked by someone who claimed to be interested in them. Because like it's a lot more common than you would think, and it's so unfortunate that it is. But we also know about McKay that she has struggled with drug use. She's too relatable. She kind of reads Robbie for filth in that she's like, you need to take this more seriously.
Yeah.
And we get to the point where she will be a little insubordinate later on, is that Robbie is refusing to call the police, so she fucking does it herself. And good for her.
Absolutely.
Like, that is when it's okay to be insubordinate, not treating patients without presenting things like that. But when you see a threat and no one else is calling the cops or doing anything, do it. Do it.
Be a hero.
But I also just like, I wonder why like Kiara didn't call. That pisses me off too.
Because he's 18. Like, it's not a child.
But he's a threat to the public.
He's a threat to. I said, I think it was last episode. Even if he's not a child anymore, he's potentially a threat to other minors.
Mhm.
That is true. Yes.
And I'm like, okay, you guys called the school to see if David went to school today. Did you tell the school that there's a potential threat? Did you talk to the SRO at the school? Anything? It doesn't sound like it. Why is no one taking this seriously?
It's mainly because Robbie doesn't want to, quote, ruin this kid's life.
We finally get a silly, goofy moment between Collins and Robbie, which is very nice, finally, to have. She has jumped up on the bed and is gonna start an IV on those rats. I love it. She's taking this so seriously. She hates rats. She's so scared of rats.
And I love that she's like, someone having a rat as a pet is a sign of a mental health crisis.
And he says, think of them as little mice with a pituitary condition. Oh, it's so good. So Dana really keeps everything moving because Robbie grabs her for absolutely everything. I swear, every time Robbie walks out of a patient's room or something, he's grabbing Dana. And she is constantly saying, hey, remember, this person is here for you. Hey, remember this? Hey, don't forget this. He's asking her about like, hey, are they going to come and take care of the rats? Anybody? Anything? He finally gets to go to the bathroom, except for the fact that Langdon interrupts him and Robbie leaves the bathroom without washing his hands.
This should never happen, obviously, but part of me wants Langdon walking and be like, oh, I've been looking all over for you. Nice cock. We have a guy. We have a guy who's
penis counter 3.
Yeah, the way that he's like zipping his pants up, he definitely like had it out, prepared to pee, and then was interrupted. But also, I'm like, how long does it take you to pee? Because it's like a 30-second experience for me. I have trained myself, and if you have not, then get there,
God.
Robbie.
I think it's just a matter of the fact that while, yeah, it'll take him 30 seconds to pee, that's also how long it could take for his patient to die.
Yeah.
Yeah, that's true.
Yeah. Now, Mr. Quinn has vaped 2 pods, which we learn is the equivalent to 2 packs of cigarettes. Rough. But I also wanted to point oh, wait. First thing I wanted to say is, have you guys ever had palpitations? It kind of feels like someone's punched your heart and set it off kilter.
No.
Like, it kind of just feels like so what happens is for me, I have palpitations. I have premature ventricular beats. So basically the heart beats at one part of my heart beats at the wrong time, and then it throws the whole thing off kilter until it lines back up. But basically, like when I have a bill one, like a woof, it's like someone punched me in the chest. And I kind of go, oh, like I'll be in the middle of a sentence and I like it's like, oh, ow. So they do hurt. Mild ones, not so much, but when you have a good one, it feels like you've been punched in the chest. They also what you've noticed a lot during the season is a sternal rub where they take their knuckles and they rub it on someone's chest. That's actually just to see if there's a pain reaction. It hurts. And so that's to see if there's like a reflex to the pain because even if someone is like unconscious, if they're not fully unconscious, they will react to pain. Like they will move to try to stop you. If they're not reacting at all to the sternal rub, then you know that they are actually unconscious. As Robbie is leaving after this patient, he does say that they need to call addiction services for this guy. And there is the briefest, like, flash of a moment where you see panic on Langdon's face. Like, he kind of looks around a little bit and he looks panicked before he, like, settles himself, which is very interesting.
You're not slick, buddy.
Honestly, it's kind of a surprise that Santos is the only one who realizes, based on
Yeah.
how not slick he's being.
They really did cut a lot from the episode 1 script of like very, very obvious signs that he is struggling, which is good because it would have just been ridiculously obvious. Because there's even a moment, the Good Morning Sunshine scene in the script, Colin says that he's so upbeat that sometimes she thinks he's on drugs. And it's like, oh, come on. That's a little too on the nose. And he's like, I am, baby. It's called life. Like, it's whatever. So it's ridiculous. So, like, good thing that they changed it, but also, like, setting the baseline just to understand. And then it's like, that's why you have a first draft.
Abbott's veteran's sister arrives, Fiona Orser. Hey, why would you leave a patient intubated post-mortem?
So I asked a friend who works in the medical field why you would leave a deceased patient intubated, like, especially because it seems like upsetting for the family to see that. At least my mom asked that. And my friend said that you would leave it there for like an autopsy or investigation. And also because like in general, it takes nurses time to prep the body. So that's just something that you will leave there. When I watched it in prep for my notes, like for this episode, which was like the millionth time I've watched it, it didn't hit me very much. And then we were just watching this before we recorded while we ate our lunch. And I almost cried because I think I'm an only girl and a middle child. And I think if I had to walk into a viewing room and say goodbye to one of my brothers.
Oh, that's something I can't even fathom having to do. No.
No. Like especially someone who should be healthy.
Mhm.
Someone who's the victim of an accident, like, I feel so emotional just thinking about
Yeah.
having to say goodbye to a sibling of mine. I can't relate to loss of a parent. I can't relate to loss of a child. But if I had to be in this woman's shoes and if I reached down to hold one of my brother's hands and it was cold, this is the first time I'm crying recording. Pop a bottle of champagne.
Woo.
It didn't make me cry watching it until just now. I'm like, man. No, like, he's supposed to be there.
Yeah.
Yeah, and when she says like I don't know what it means to like be without you, like that.
Yeah. Oh
Oh,
my God. Yeah.
yeah. And it's also very interesting that this is the first like I mean we met Abbott a little bit in the beginning and got to know him a little bit, but like this is kind of a big insight into him and his mindset and like coming from him, but also like he's not here, which I think is a very
Mhm.
interesting way to like have us get to know this character who, you know, we will see again towards the end.
We don't get to see him lose patience emotionally like everyone else does
Yeah, like
until
he's
now.
He's very here and very present, even though he's not like physically here.
Yeah.
He is
And
hopefully at home asleep.
yeah, bitch. I think there's also a weight of like this woman, same as like Abbott says this, is how many tours? 3 tours without a scratch. And he gets hit by a drunk driver and it's done. It's over.
Yeah.
Can you imagine like your brother goes to war and is deployed and comes back and everything is fine. He's fine. And then he gets hit in a crosswalk. There was a woman, she was like a pioneering attorney in Nashville. And this past week she was hit in a crosswalk. I think it was like a country music artist. Unfortunately hit and killed her in a crosswalk. And people have been standing at that crosswalk with signs that say slow down. And they've put up like yield signs and all that kind of stuff. And people are literally standing out there and stepping into the street with stop signs while pedestrians are walking by because they are so worried. And it's just been so difficult for the community because this woman was so beloved and so influential. And she did such great work in her life. And then she was on a walk with her dog. Like, what a heavy ouchie boo boo, you know? Like, I don't know how else to.
This episode has taken a real bummer turn.
But it's good. It's supposed to.
Hey, I mean, I don't have a penis joke, but we have homophobic joke. Not really, but like.
No. Myrna, her nicknames for Robbie are so
Oh, gosh.
homophobic.
During Pride Month,
Fruitcake
do
and
better, Myrna.
cocksucker.
I love Dr. Robbie. He's like, listen, I put up a lot here and I treat you very well. So, you know, you can call me Dr. Rabinovich or Dr. Robbie, or you can use my first name of Michael. And she's like, oh, did I hurt your feelings, cocksucker?
There's some whimsical quality that he can learn to live with.
And then we cut to an ambulance getting stolen, which apparently happens pretty frequently in the US, once or twice a week.
That's
Isn't that
crazy.
crazy?
But also, like, if I
I
was going
looked
to
it
steal a
up.
car and take it for a joyride, like an ambulance seems kind of fun.
I mean, it is full of drugs, so.
Yeah.
Didn't even think about that part. I was just like riding in the Wii U wagon.
Ambulance gets stolen. Hey, did you leave the keys in the ambulance? Yeah, that's probably not proper protocol. I just left it in there in case someone needs to move them. Yeah,
Well,
someone
they moved
them.
it.
Yep.
But the wrong person did move it.
Frat boys, god damn it.
And the episode kind of ends with Robbie having to now counsel the Spencers through death.
Finally, Helen has agreed to let her father go. And
Yeah.
I just don't envy Robbie for having to be the one to walk them through this entire process. Emotionally, I don't have the energy for it.
No.
Like, I give him a lot of shit for the fact that he's not being as kind to her as he could be. However, I genuinely, like, a couple minutes in would have been like, okay, bitch, listen up. Because, like, I'm such an emotional person that I have to lay the law down because I'm like, I can't be emotionally in this with you right now. I can't expend myself like that. And that's why I'm not a doctor.
That makes sense.
Any final thoughts?
Remember to pee now before you attend to more patients.
Yeah.
Mhm.
No UTIs.
Go piss
Maybe that's
off.
why Robbie's so psychotic, is he has a UTI.
Robbie not being able to pee was one of the first things that like really stressed me out about this show. Like I was like, the death, these like really intense cases, fine, whatever. But then I was like, someone let this man pee or I'm gonna lose it.
Somebody let this man pee. That's all he needs to do.
And it's actually funny because I just realized there are multiple characters that are like, I'm gonna go to the bathroom, and nobody stops them. And Robbie's the only one because Langdon does it, McKay does it. No, sorry. Yeah. Langdon and McKay both do it. Langdon is talking to Mel. It's in a future episode. We haven't got there yet, but he says, I'm gonna hit the head, and goes to the bathroom. And then McKay in this episode, isn't it this episode? It's last episode, says to Javadi, actually, I have to run to the bathroom. Are you okay on your own? No, it's this episode because they're walking away from Jenna.
Point is, everyone can pee but Robbie.
Everybody gets to piss except for your boy. I think that's all we've got.
Yeah.
I cried for the first time, so there's that. So Mal, it's your turn next.
The next one will get me. The next one will probably get Robert and I both.
Okay. Well, if that's all we've got, then so long, fellow losers.
The Pit Crew podcast is created and produced by us, Robert, Mal, and Camille. It's edited by me, Robert. You can find us on TikTok, Threads, and Instagram at Pit Crew Podcast. If you'd like to support our other projects, our socials are linked in the show notes below. Our art is by Rampacoca. He can be found on Instagram at Rampacoca. All patient questions and concerns can be emailed to pitcrewpodcast@gmail.com. Now, this isn't a Taco Bell, but we do appreciate a 5-star rating and review wherever you get your podcasts. Be sure to schedule a follow-up appointment with a nurse before you go. See you next time.